Welcome to Age-Friendly South Portland's Healthy Aging Virtual Vendor Fair. Age-Friendly South Portland is a City Council designated committee and an AARP certified age-friendly community focused on developing programs and partnerships to help our residents thrive as they age. Since early 2020, Age-Friendly South Portland has collaborated with the Maine Council on Aging and many community partners to assess the needs of South Portland's older adult population. As an outcome of the project's initial phase, challenges with falls and fall-related risks were surfaced. In 2020 alone, nearly 1/4 of all emergency medical services calls reported by South Portland residents over 60 years of age were for fall-related incidences in private residences, with 66% of those calls reported by adults between the ages of 70 and 89 years. Accordingly, a decision was made by Age-Friendly South Portland to develop a citywide campaign intended to educate and establish awareness of falls prevention and intervention best practices, lessons learned, and available resources. On behalf of the Age-Friendly South Portland Committee, we are excited to share with you the following clips of just some of our amazing community partners who are working to promote strength, balance, and activity as a way of helping older adults overcome risk of falling. Enjoy!
Hi, I'm Sue Henderson. I am a member of Age-Friendly South Portland. I am on the City Council and I'm a retired nurse educator. Maxine Beecher invited me to work on looking at assessing the needs of the elderly probably about 4 years ago now. And we have grown and been a vibrant organization since those early beginnings. Some of the things, our mission really of our organization is to help elders in South Portland age in place with safety and dignity. And in doing that, that really it benefits the entire community for the things that help both the older people and they also help the younger people. We have, after doing an assessment of the city, we identified several projects based on this assessment. And so we are working on several large headings of projects. The first one is communication. We noted that many seniors do not have internet access or are not real comfortable with the internet. So we have tried to develop communication strategies to reach people that are not dependent on the internet. We have articles in the Century. We have things on South Portland TV. We have them on some fairly scheduled times so people can find them. And we made flyers to put out in libraries, in City Hall, and in the community center. And then during the COVID pandemic, we tried to do short videos, did you know, that are played on South Portland TV. And this is a communication strategy, but it's also giving information and it also helps with social isolation. Another issue that people was important on the survey was issues related to transportation, both on foot and on vehicles. So we have members on the bike ped committee. We advocate for improved pedestrian improvements, for improving crosswalks and signage and slowing the traffic. We've been, I think, quite effective in working on some of those things. Changes happen slowly, but they are happening. The State Department of Transportation, Patrick Adams, came down to 3-day workshops with the public. I guess it was last winter. And we have several projects that are to happen to improve crossing and safety in crossing the streets, slowing traffic, making the streets safer for all people. That's the concept of complete streets. Our committee has given some money to the social service department to help people get rides to doctor's visits if they need help to pay for that financially. And we've also worked with the transportation director to make some suggestions and through the bike ped committee about the problem of lack of the large buses being able to access the food pantry. So some arrangements were made to help deal with that issue. Now for homes, there are many things that people would like help with their homes. And we have started off with snow. And the very first project we did was the easiest one, but it's been very, very successful. We have set up with the Public Works Department a process where people can call and request a sand bucket, and it will be delivered to them for free. Friendly South Portland buys the buckets, and actually we had a grant from Home Depot for $3,000, I believe, that helped supply buckets. The Public Works Department fills the buckets, and sometimes they deliver a few, but they're often too busy, so we have volunteers deliver the sand buckets. Last year, for the first time, we put up sand barrels in Knightville and Thornton Heights, where people could reach in and sprinkle sand on icy sidewalks in those two neighborhoods. And we achieved the goal of having volunteers shovel sidewalks for people. That has been a great success. It took quite a while to get it started, and we hope we'll be able to build on that very well and do that again this year. And then we also did a golden shovel program that was just kind of a trial, but I think it worked nicely. And we gave a golden shovel to the business that had the best feedback for having clear sidewalks. Then we, in terms of health and community, we had a lot of good things going, and then the pandemic hit and they had to be stopped. We had a Matter of Balance scheduled to be done at the library in South Portland, and we had Tai Chi scheduled, and we had meetings with representatives from Southern Maine Agency on Aging to help people understand how to access resources such as healthcare, social service resources. And we had to not do that in person, of course, during the pandemic, but we are planning to restart that. And that will be coming along as the health COVID system allows. We have, we mentioned doing the, did you know, videos that have information, but they're also geared to trying to connect people with their community. We have done some video of Tai Chi at the community center that's been on community television. And last night and this morning, we had a wonderful program scheduled on how to prevent falls and how to have your fall risk assessed and things that you could do to help you be strong and better balanced to avoid your falls. And then we had a community walk planned. And because of the terrible weather report for last night and today, we canceled both those events, but we intend to schedule them again in the spring. We have worked with the Maine Council on Aging to develop a South Portland data dashboard. And the purpose of that is to have data available to the city that might help them identify the needs of their elder citizens. And we're a pilot study because this is a very big issue statewide. So we are a pilot project for an urban environment, but there'd be rural and smaller towns having pilot projects too, and eventual dashboards. We found that we have data available about the number of rescue calls related to people falling. Now, these can be looked at without having access to any people's names. It's all confidential data. It's just number of people who have fallen. So we have a sense of how many of the rescue calls are related to falls, and how old people are who have fallen, and where did they fall? Did they fall in their house? Now, what we'd like to work on to develop further is if we can assess why someone fell, and that would involve having the person who fell give permission maybe to have someone come into their home and talk with them and see if there were things in the home that were maybe contributed to falls, like poor lighting or slippery throw rugs or dog toys or toddler toys, that kind of thing. Or maybe they needed a handrail. Or was there a problem with their medications, or were they hungry, or were there other health issues? So we would hope that we could do something to help the person who had already fallen avoid future falls. But then we really want to focus on people who are young and healthy, vibrant, understand that, okay, you need to start when you're fairly young, and you can keep yourself strong and improve your balance. So as you get older, you're not an increased risk of falls, because just the normal aging process increases your fall risk for a wide number of reasons that we can't list here. So those are some of the things we are doing. We are an AARP friendly city. We have to write an action plan to be certified, and we're trying to get that done this fall. And Maine is an age-friendly state. So we have a good supportive environment, a good supportive city, and we're really seeking to help our older citizens enjoy life and be healthy. And we can always use helpers if people want to volunteer. And we have a website, Age Friendly South Portland, a Facebook page, excuse me, not a website. And the Social Service Department, Kristen Barth is we're city committee, and Kristen is our staff person. So we could be reached through the city, could be reached through me on the city council. But probably I would try first through the Facebook page, Age Friendly South Portland.
All right, well, thanks for taking a minute to learn a little bit about the Balance Center. My name is Jason. I'm a physical therapist, and I'm here to talk about the Maine Strong Balance Center. So the Balance Center is a physical therapy clinic, and we're a group of physical therapists who specialize in balance. And to sort of tell a bit more about it, I thought I might go back to our origin story in terms of how we all sort of got started. So I was trained in the Boston area. I went to the Massachusetts General Hospital Institute of Health Professions, and I was living and working and training down in the Boston area. And what became clear to me sort of at that point in my career is that I really, really enjoyed working on balance. I just found it so interesting professionally. In other words, there's so many factors that go into it. I found it really engaging. And I just found it really rewarding. If you can do something meaningful for somebody so that they're feeling more steady on their feet, it's a really nice sort of fun thing to be a part of. The other thing I noticed sort of in that earlier part of my career is that the healthcare system doesn't always serve balance the way that I would hope that it would. There's really brilliant physical therapists, and there's really thoughtful, healthcare systems that are trying to do really great things, and they are. But one of the downfalls is that if you're going to work on balance, it really takes time. And in healthcare, traditionally, it's really hard to get one-on-one time with anybody, let alone enough one-on-one time to sort of address balance. So with these sort of pieces in place, knowing that how fun it is to work on balance and how rewarding it is, and seeing the healthcare system, which has brilliant, providers in it, maybe not doing as good of a job as it could, the idea for, building a center or a physical therapy clinic that just focuses on this was born. And I was really lucky enough to meet my wife in the Boston area, who happens to be from Maine. So now we make our home in Maine, and we founded the Balance Center here in Southern Maine. So the Balance Center currently is in Scarborough, but we do have quite a bit of programming in the South Portland area. So keep an eye on the community center and age-friendly South Portland to sort of see different events and classes that we'll be running in your area. And we're also interested in expanding our services specifically into South Portland. So we're just sort of a hop, skip, and a jump away in Scarborough. And we're sort of ready and willing to help you now if you need help with your balance. But stay tuned, because we should be in your town in the not too distant future. So the next piece that I sort of wanted to unpack a little bit is the Balance Center is sort of a new idea. And I think it takes some explanation in terms of what we do. So in some ways, we're doing the same things that an outpatient physical therapy clinic does. So what I mean by that is we're a group of physical therapists, and we do things like take insurance. So, you know, if you've got Medicare or Anthem or an Advantage plan, these are all things that we use to sort of pay for our services. There's other ways that we're different. So these are sort of what sort of the foundational properties of what makes up the Balance Center and sort of what we're doing in the community. So the first thing that's kind of, you know, first and foremost is time. So if you're going to make a change in your balance, or if you've got someone who's worried about falling, or maybe has fallen already, or anywhere in between the two, it takes time to sort of invest in your balance. So the evidence for changing balance is that many hours over many months is sort of what it takes. And you need somebody there to sort of help you. So in other words, if I'm going to ask someone to do moderate to high intensity balance exercises, I've got to be available. So at the Balance Center, what we do is we spend 40 plus minutes of one-on-one time each session with somebody, just hammering away on the balance. And again, this is an area where in healthcare generally, we haven't been able to sort of deliver. And then over time, what we find, and this is sort of, you know, evidence-based, in other words, this is what the literature shows us, and then this is what the data is that we track at the Balance Center, we make big differences. So if you spend time with somebody, either showing them what to do and they do it on their own, or doing it one-on-one in the clinic, you can have profound impacts in someone's balance and fall risk. And as a result, you can sort of, you know, be really transformational in their life, which is, again, fun to be a part of. So time is one thing that's sort of different, or what sort of is foundational to what we do at the Balance Center. The other pieces that I sort of wanted to talk a bit about is we do spend quite a bit of time on the assessment. So when someone comes through our doors, we spend usually about an hour with them, again, one-on-one, and we're taking a history. We're just trying to really listen to what are the different factors that play into this individual's sort of fall risk or balance concerns. So as some examples, you know, if someone has a vision issue, or if someone has pain in a certain area, or if someone's on a number of medications, or if they've got a blood pressure issue, these are all things that can negatively contribute to someone's balance. And even though they seem like different body systems, they're really related, and they're statistically related, meaning they're powerful predictors of who's going to be off balance. So a big part of what we do is we're really listening and trying to get the full picture as to what's going on with somebody. The next piece that kind of really makes us, you know, a Balance Center is that we spend a heck of a lot of time on the education component. So during a session, we'll spend a lot of time doing fun balance exercises. We've got harness suspension systems, or we're walking through obstacle courses, or doing all these really creative, fun balance exercises. But usually, or typically, the other half of the time is spent on education. And by education, I mean quite a few different things. So sometimes we're on the phone with the primary care physician talking about blood pressure medications, or other times we're on the phone talking to the optometrist about you know, what we can do from a vision standpoint. Other times we're, you know, spending time on trying out walkers or canes or walking sticks, and we go outside and around the building and just try to figure out what's the right device for somebody. Sometimes we're just sitting down and talking about home safety. There's simple sort of tips around the home, and if someone's having trouble, for example, in a low lit area, that might be a low hanging fruit sort of consultation about how to change that home environment. And we're also spending time on things like how to fall more safely, or how to get up off the floor if you needed to. So again, we're doing really sort of fun, high-level balance exercises, one-on-one with sort of an expert physical therapist. And we're spending a lot of time on the education piece to sort of treat the whole person so that we're cutting down on your risk. The other piece that I really wanted to sort of share is that we're really good at collecting data. So we've got sort of a core set of tests that we put everybody through. And I liken it to like when you see your primary care physician and you get your blood work done and they're checking your cholesterol levels and your blood sugar levels. At the Balance Center, we've got a standardized core set of tests where we're testing your strength, your balance, your endurance. What does your walking look like? And what we can do is we can put that data into our software, and then over time we can track it. So after a month of physical therapy or after a month of exercise on your own, we can take you through the tests again and see how we're doing. If we're doing better, great. We sort of keep going down that path. And if for some reason we're not doing better, okay, that's an inflection point where we want to change what we're doing. The other way that we're using this data is we recognize that balance is not a short-term issue. It's not something that's rehabbed and then just sort of goes away. Balance is something that's foundational to somebody's health over time. So another program that we've got set up is if you would like to, after sort of receiving services, check in the future, oftentimes we'll recommend coming back for sort of a balance physical at 6 months or a year down the road. The idea being that we can take your data points again, compare them to how you were previously, and make informed health decisions. Again, similar to the blood work, if the physician notices a change in your cholesterol, that might be a change in medication. If the physical therapist at the Balance Center notices a change in your balance scores or a change in your walking or strength, we might recommend a different set of exercises. So that brings me sort of to the exercise prescription. At the Balance Center, this is what we do all day long. So all of the staff is taking continuing education. Some of us are clinical specialists, meaning we have advanced training in this area. We're comfortable tackling the vestibular system, which is something that is sort of a specialty. So my point is we've got a group of really smart therapists who are highly trained, do this all day long, and they're ready and willing to help. And they're excellent at curating or crafting a home exercise program or helping with the balance. And then the final piece I wanted to communicate is that, we recognize that balance is something that takes collaboration. At some point, outpatient physical therapy can't do it all. And we're really excited to partner with the community to do, interesting, innovative things to help. So as I mentioned in the beginning, keep an eye on the South Portland programming at the community center, or which is the age-friendly group. And you'll see us around now and in the future, sort of offering different community classes or educational lectures, with the idea being that balance is a long-term project that needs investment over time, and nobody can go it alone. So I appreciate you taking some time to listen to me and hear a bit about the Balance Center. If you have questions or you're not sort of sure how to proceed, you can check out our website, which is www.mainstrongbalancecenter.com, or you can call us. Our phone number is 207-303-0612. And if you've got questions about anything, how do I start physical therapy? What do I need? Can you, come to South Portland to meet this need that the community is noticing? We're here, we're available, and it would be absolutely our pleasure to help. And I know sometimes healthcare is confusing in terms of, do I need a referral or what does my insurance cover? And to keep it simple, just contact us and we'd be really happy to sort of walk you through and do some of the legwork for you if you need any help. So just in sum, if you're somebody who has questions about your balance, you qualify for a balance assessment. You could be more than welcome to come into the Balance Center and we could sort of let you know about your risk. If you're someone who's got some questions about balance and wants to learn more about the community sort of programming, you can absolutely come into the Balance Center, have a battery of tests, and then we can communicate with you to connect you to the right community classes. And if you're somebody who really, feels they need one-on-one care, again, this is what we do all day long, and it would be absolutely our pleasure to help you. So thanks again for spending the time with me. If you've got any questions, reach out to the Balance Center, and in good health. Hopefully we'll talk soon.
Hello, my name is Norma Simpson. I'm a member of the Southern Maine Boat Sport Association. Southern Maine Boat Sport Association is a member of the American Boat Sport Association, ava.org. And it's a program that started in Germany, and the local club started in 1983 by 4 teachers at the Westbrook High School. And during the early years, we had the distinction of having the largest walking group for the AVA Association. And that was in the South Portland Bug Light Walk, Lighthouse Walk that we have, and we still have. The AVA Association has more than 200 clubs across the country, and they're a part of the Canadian program and the international program. So people can walk all over the world doing these activities of, if they have personal goals of walking every state capital walk, states, special events. The goal is to, mission goal is to have fun, fitness, and friendship. And some of the members in our club, how many? 30, sometimes more, sometimes less. There are a lot more walks out there now for raising funds for organizations. This volunteer group just does it for the fun, fitness, and friendship. So there's no pledging. It's just pledging yourself for getting fit and getting out, socializing, and meeting new friends, finding new areas to walk. Some of the benefits that SMVA walking, for whether it's for South Portland residents or anyone, the fitness part is helps your bones, your muscles strengthening, weight management, the benefits of socializing, not being isolated, meeting new friends, seeing new places that you maybe have seen it, but seen it in a different light. Heart, lungs, oxygen level. Walking, whether it's with our program or any program, has many health benefits to help either ward off more falls or prevent them by strengthening your body for doing it, of disciplining yourself for exercising. And when you do it with friends, it's more enjoyable and it's more motivating to get out and do it. A walk we had this summer was forecast, like this weekend was, for rain, but we did it. We don't do it in downpouring, but it turned out to be a beautiful evening in Freeport that we walked. It was just misty, but nothing deterrent, and it was a surprising, pleasant surprise of walking in Freeport. The SMVA walks are non-competitive. You do it at your own rate and your own timing. There are what we call sanction walks by the AVA Association. They have a specific length, a certain route. Restrooms need to be available. The footing needs to be good footing, pavement, good sand, surfacing. What else do they? So that way, there's a certain basis that you know if you go from your own state here or go to a walk that's in Texas where your relatives are, or New York, something like McDonald's, you know what you're getting, pretty much so, although all walks are different. The walks, they're free. We have 4 sanctioned walks for our SMVA club. One is in Augusta, one is in South Portland, one is in Portland, and one is in the Kennebunk Port area. And how do you find out about them? I'll give you information at the end of how to contact us, but those walks are free. But for folks that like to keep track of the kilometers that they walk, because they're either 5K, 10K, or 11K in the different states. And that's roughly just over 3 miles, just over 6 and just about 7. And some people like to walk all capital walks. And so if you want to keep track of walks, know what's going on, by being a member of our association, you get a bi-monthly newsletter, you get updates of what we're doing, what AVA is doing, and it keeps you in the loop of special events. On the docket is, we've talked with regional people and we're looking at, if COVID is cooperative, maybe a year from now doing a New England, like Maine, New Hampshire and Vermont or Massachusetts type of walking for a weekend. One walk will be in one of the states and another walk will be in the bordering state. And so that's what we're hoping to be able to do. For our own walks, we have walk boxes that are located in different facilities that you can go in and sign in that you've walked it, so you can pick up a map and know what the route is. You can go by yourself, go with friends. And with the newer members coming on, we have what they call online stop boxes. So if you are going, whether our walks or out of state, you can go online and find out where they are and sign up for them, so that the folks at the other end on the date of the walks, they'll know who to expect. And if there's any changes, they can notify you saying, it's a weekend like we're supposed to have had this weekend, and it'll be postponed till whenever. A lot of the clubs don't do free walks as SMVA does. There's usually a charge around $3 for the walks, but it's some of the states are bigger than ours. They have more volunteers. Yes, it's a volunteer organization. At the AVA level, there's a few paid staff, but on the state level, it's the volunteers that help find the walks, make the distance be what it needs to be, check out the criteria that I mentioned earlier so that it's consistent and reliable. But for us, we also have non-sanctioned walks. We call them intro strolls, and that's around our southern area of Maine usually, so that people can meet some of the folks. You won't meet the same ones every time because it's like other group activities. Some people are available for that walk and sometimes they aren't. And you get to a feel of if you want to do it on a regular basis with the group or some of the people. Sometimes you meet people that you get to walk with on your own on non-SMVA walks. Can everybody do them? Our walks are rated so that the description will tell what kind of pavement it's going on, where it's going to be, so you can decide if it's your level. But most of the walks are good for most anyone with rollators, baby carriages, and if it's longer, 3-6 miles, well, you don't have to do the whole walk. You just let the leader of the group know that you're turning back, going back to the parking lot, whatever, or going to stay at the picnic bench and wait for folks to turn around and come back. So it's, again, at your own level, and you find your area of what you're up to. And some days you may be up to more, and other days listen to your body and, enjoy the day. You don't want to go home regretting walking so much. But as you build up, I've been in the group for about 4 years, and I thought 3 miles, but talking with friends, looking at sites, pointing them out, the maps tell what's along the way. We try to have something interesting. And with our South Portland walk, that's easy to do with the scenery that we have and the history in the South Portland area and over at Bug Light. Membership, how much is it? It's $12 for an individual or $15 for 2 or more for a family. You get a bi-monthly newsletter, the updates from our club, what we're doing, where we're doing our New Year's walk, what we're added in since the last time we communicated, whether it's via emails, hard copies, snail mail. For some of the newer members, as I mentioned, we're doing computer online for start boxes, so you don't have to go to a certain place. And with COVID, it's worked out well. But some folks aren't savvy with computers, so hard copy information is still out there. The information, I'll put it up again. That's us. And think that's it. Oh, why did I join? Well, somebody I knew was in the club, and they said, well, come along for one of our interest strolls and see what it's like, what we do. And so I did. And this summer, my discretionary time when I just didn't walk around my neighborhood was with the Vote Sport members that I'd met. It was outdoors. It kept me motivated. Oh, I can do it. I can save the time. And I did. And I did it for the next walk this summer. And so it was very beneficial for having that little motivator carrot that was you were already connected with, instead of having reinventing it each time. So that's, you get to socialize, try to take care of your health, weight management. If you have diabetes, need to strengthen up. Osteoporosis is so common with our age group, and our age group, I'm referring to the age group that I'm in, but some of the folks that are younger members, they may have hidden osteoporosis that they haven't found out about. And if you can strengthen your bones and the muscles around it by walking, that helps with your balance and not having the fear of almost feeling that you're falling. The more you strengthen yourself, you have more confidence to go out and do it more. And just even walking around your house and yard, you have more confidence. And that's part of it, your mental psyche of that you can do it and that you're improving. So the information that I have on my fancy sign, and there's also a number that you can call if you want to talk to a real person. They'll answer on the other end by emailing or Facebooking. But a number that you can call is area code 207-245-8233. Hope you consider joining Southern Maine Vote Sport Association, and the walk that we have right here, one of what people from all over the country, just like with out in Cape Elizabeth or Bar Harbor, they come from miles away, but we have it right in our backyard, and it's there free for the taking. And if you want to do the certain walk with the 5K distance that's mapped out over in the Bug Light area, give us a call and join us for our next walk. Thank you very much for planning on doing this healthy aging workshop this weekend. And we're all looking forward to having it in a sunny day, or at least a snowy, pouring day next spring. Thank you again.
Hi, my name is Angela King. I work for the Bicycle Coalition of Maine. I'm the advocacy manager, working with people around the state to help improve road conditions for walking and biking. And the Bicycle Coalition is happy to be part of age-friendly community meetings because we have many shared goals. Both of us want to increase the quality of life by making environments that support and enable people to be physically active. And the Bicycle Coalition of Maine works with residents around the state to help them improve road conditions in their cities and towns for people walking and bicycling. And age-friendly communities want to enable people of all ages to be both physically and socially active. And walking and bicycling have physical and mental health benefits. They're not just forms of recreation, as you know, and they're modes of transportation for older and younger people who are not able to drive. This is a way for them to access destinations. but what we hear from a lot of people in the state is that without infrastructure such as sidewalks or bike lanes or multi-use paths, they don't feel safe or comfortable on many of Maine's roads. So in order to make roadways safer and transportation more equitable, road designs have to consider people trying to get around who are not in automobiles. You know, one of the biggest deterrents that we hear from people to walking and bicycling on the roads in the state is the speed of cars. So for this reason, the Bicycle Coalition launched a campaign called Slow Me Down, ME for Maine, abbreviation. And driving slower is safer for all road users, as you know. So it's cyclists, pedestrians, and motorists alike. So this campaign is to create a shift in the driving culture by reminding drivers that speed limits are for safety reasons and should not be exceeded. And there's also a concern in many communities that the speed limits are set too high, and the Bicycle Coalition supports putting safety over speed when setting speed limits. Another one of our programs is a community spokes program where we help people organize their communities to make these changes in their communities so it's a network of people, bike ped advocates around the state, because really you need the grassroots level, that local residents organizing and speaking up to get the changes that they want to see in their communities. And these can be anywhere from like programs such as safety education for both bicyclists, pedestrians, and motorists to help people be more aware of rules of the road. So we do a lot of education in both schools and adult education and driver education. And we're involved in policies such as encouraging and showing people the benefits of complete streets policies, sidewalk and bike lane maintenance, snow removal. Those kind of policies have an impact on whether people feel safe to walk or bike. And then the projects would be to change road design through traffic calming measures. So we have a program called Imagine People Here, and it's a temporary demonstration project, either narrowing travel lanes, which has been proven to slow cars down, enhancing crosswalks, making them more visible, and signage on the roads is another low cost way of catching attention of motorists, and all these measures can have a positive impact on bike ped. And these temporary, Imagine People Here is temporary, so it's to test out a roadway change and then get feedback on if this has been helping. And the goal is to make it permanent, but it's a low cost way of testing out roadway changes. We do have programs for cycling for adults, and we've heard from in recent years older people wanting to get back to cycling who have gotten e-bikes, and so they feel they have that support. If you're familiar, electric bikes, they are pedal assist. So for example, if you're riding and you come to a hill, which is very often in Maine, it would kick in to help you get up a hill. And we've heard from many people that it has gotten them back to riding bicycles after a time where they felt they couldn't anymore. Anyway, so we've helped them with this e-bike education, getting back to cycling and feeling comfortable, and that balancing. But the other thing is, in this recent legislative session, this past one, there was a bill, a law to enact to ensure that public ways are compliant with the ADA law of the 1990s. So even though that's a federal law, you really have to ensure that states are following it when they do construction or reconstruction of public ways, that people considered, people in wheelchairs and other people are considered when they do these construction projects. And that is a law now in Maine, and you can, if you're having a problem or feel that a sidewalk is not safe, to contact your local officials. And it is a state law now that sidewalks have to be, and other areas have to be well maintained for people with disabilities. Well, we would love to hear from people who are interested in any of the programs, the campaign, or join the Bike Ped network of community spokes. Please go to our website is bikemaine.org. And you can find information there and contact us and be happy to engage with you. Well, I would like to say, I think that South Portland residents are very organized, and a lot of positive things are happening there. So I'm glad for the community, and we're glad to be part of it.
Hi, I'm Chris Kraus. I'm the Director of Business Development with MedCore Professionals. I'm also an occupational therapist and have been for the last 28 years. MedCore Professionals, as you can see from the sign behind me, is a home medical, rehab supply, and specialty durable medical equipment shop. And we carry a broad range of products, specifically mobility products, aids to daily living, like tub benches, shower chairs, and anything you might need to be more independent in and around your home and the community. We also sell and service a full line of bracing and other types of supports, from ankle braces, wrist, knee, hip, back, you name it. We cover bracing and supports. We also cover non-narcotic pain management, things like TENS units and other different types of non-pharmacological approaches to pain. And we also specialize in custom medical grade compression garments, off-the-shelf medical compression, and post-mastectomy wear. So we're a full line shop, and we're located in Scarborough, Maine, on the north end of Route 1, right behind Lois's Natural Marketplace. One of the things related to mobility that we like to provide is lots of patient education. And we work with pretty much all, if not most of the area rehab clinics, physical therapy centers, lots of the area chiropractors and physicians and healthcare providers from nearly all walks of healthcare around the southern Maine area. We do mobility workshops. Just recently, last week, Tony, our mobility specialist, and myself did a presentation to the Scarborough Community Center on the different types of mobility and what different mobility needs people could use for different levels of their physical ability. We do stuff like this, where we do lots of community outreach, going to health fairs and things. And hopefully, as the community opens back up, as we work through the pandemic, we'll have more opportunities to do so. And we're always looking for opportunities to engage with the public, talk about our services, what we do and why. And we really do feel like we offer a special offering at MedCore. We're a small, privately owned local business. It is an amazing group of people. I've been in healthcare for 20 years, and the level of expertise, clinical professionalism, and heartfelt care that's delivered at MedCore has really impressed me in the last year since I joined this team. As far as things that people can do to maintain their mobility, as a therapist for a long time, I've given lots of advice and talked to lots of people about different ways to maintain their mobility. And it really comes down to a small handful of things. First and foremost, you have to stay active, have to stay mobile. And if you go to our website and you look at our blogs, there's a number of blogs related to mobility that break these steps down into sort of incremental ways to approach it. But the bottom line is something, anything, any type of movement and activity and social engagement is better than nothing. And the more you can do, typically the better it's going to be for you. That's the first step: staying active, staying mobile, and challenging yourself to continue moving. Our tagline is, "We keep you moving forward." And that's really something that we take seriously. So that's the first big step. The second step is take help and work with area experts, whether it's your doctor, your physical therapist, a chiropractor, anybody that you trust in the medical or healthcare world. Work with them about what the best steps might be for you and your specific abilities. flexibility, strengthening, general mobility, and working on those skills will help you stay mobile, healthier, happier for a longer period of time. And then the last layer of this is once you get to an ability level that you're continuing to work on or that you're comfortable with, if you need a mobility device or a support of some sort, go for it. Any type of mobility is better than no mobility. So if it requires a cane, crutches, a walker, a wheelchair, use the right device, just like we use the right devices in the rest of our world, whether it be a tool in the kitchen to be efficient or a car to get to and from work or where we want to go. We all pick different devices to help us through our lives. It really shouldn't be any different with a mobility device. So coming into MedCore, finding somebody that can talk you through how to use a walker or a rollator appropriately and how to use the right tool for your abilities is critically important to maintaining overall healthy habits and mobility and health throughout later life. Anybody that's interested in learning more about what we can provide, the services we offer, and any of the products that we have in store, there's a number of ways to reach out to us. Obviously, you can come visit us. Again, the address is 152 Route 1 on the north end of Route 1 in Scarborough. We're behind Lois's Natural Marketplace. You can come to the store, you can see and try all the different variations of mobility equipment that we offer or anything else that we have in the store. And you'll be greeted by somebody that takes your information, talks to you about what's clinically, physically, emotionally going on in your life and how that fits into your specific mobility needs. Then we'll work with you with your abilities to find the right product or work with a product that you might have and make sure that you can safely learn how to use it, get around with it, and generally find the right device for your abilities. You can also go to our website, which is medcorepro.com. And certainly you can give us a call. The number at MedCore is 207-222-2828.
I'm Michael Elliott. I grew up here in York County. Well, Tai Chi starts with the feet. There's a metaphor called the two bubbling wells, one in each foot. And it's simply a matter of finding your root, as they say in the Tai Chi practice. And then if there's any defect in the form, you go immediately to the legs and the waist. So the movements are choreographed, but they're choreographed around the posture that you can create with the knee to foot alignment. And then simple movements like making sure that you step forward with your heel and backward with your toe. So that's kind of the basic idea. The upper torso has different expressions of energy, let's say. They have names, they have martial applications, and after you practice them a while, a lot of the issues that are associated with getting older, like stiffening of the shoulders, stiffening of the joints, start to loosen up. There's actually a Tai Chi that's done strictly for arthritis now, that's focused on those movements. So, and of course, people are jumping on board with that. The fall risk, of course, is associated with fear, and the fear is a mental state. So one thing that Tai Chi does fairly quickly is allow people a fourfold approach to how they process their emotions. The Chinese word is song, S-O-N-G, and song has to do with being relaxed, it used to translate just as relaxed, but it's a lot more than that. And loose, connected, and then full, so that there's a sense of fullness in whatever you're doing. It's not, there's no sense of lack as far as am I going to make a mistake, or am I going to move forward without any confidence? And once you've overcome that fear through the practice of Tai Chi, a lot of other health components start to operate in your body. Now, the CDC, the Center for Disease Control, got a hold of a lot of this information about Tai Chi that it would be a very excellent way of preventing falls because of the footwork and the discipline. So if after about I think 10 years it got outsourced through the Oregon Institute as a research institute, and someone named Fuzan Lee took all that information and created an 8 posture form. So the Tai Chi that I teach to seniors is that it's known as Tai Chi moving for better balance. And I do that at South Portland Rec, and I'll do it on a private basis if people really feel they want to take lessons. I do it on Zoom for a therapy place in Connecticut. So I'm expanding the scope of what I do. I have a movie that I'm going to be showing at the rec department. I'd love for people to sign up through the rec department, called The Professor. And I have it right here on the shelf. And The Professor was the guy who brought it in the 60s. This is the form I learned. Probably can't really see it easily. And it's subtitled Tai Chi's Journey to the West. And that's where I come, that's where I received all the Tai Chi that I do now. And it's about Chen Manching, who was what they called a master of the 5 excellencies. And Tai Chi was the 5th excellency after Chinese medicine, calligraphy, poetry, what am I forgetting? Painting. So he was very skilled representative of Chinese culture. And I highly encourage people to come see that movie called The Professor. Look for that in the bulletin there.
My name is Chloe Gray. I'm a volunteer coordinator for the Senior Companion Program of the Opportunity Alliance. The Senior Companion Program pairs volunteers with older adults in their homes to help them maintain independence. Some of the activities they can help older adults with are transporting and accompanying them to essential errands like grocery shopping, going to the pharmacy, banking, going to doctor's appointments with them. And they can also be a friendly visitor, going for walks with them outside or when the weather allows outdoor visits. One example of our volunteers helping older adults in their home is an example of a volunteer who has a vision impaired client. And she and the client used an app on the client's iPhone so that the volunteer remotely could walk her through fixing an appliance in her house. And they can use this app as well. It's a visual broadcasting app where they can use it to direct each other, or the volunteer can help the client complete tasks by seeing what she's seeing on the camera. You can contact our program to ask for a senior companion volunteer by calling us at 773-0202. If you're interested in becoming a volunteer, Our volunteers are older adults, ages 55 and older, who want to volunteer their time to work with older adults in their homes.
Hi, I'm Anna Guest. I am the Community Education Director with the Southern Maine Agency on Aging. And I'm here to talk with you today a little bit about what the Southern Maine Agency on Aging is and what some of the services are that we have to offer around balance and falls prevention. So if you're not familiar with us, the Southern Maine Agency on Aging is really a great one-stop or first-stop shop for resources and information for older adults. We have a lot of different services to offer the community, and we serve York and Cumberland counties. We have everything from nutrition programs like Meals on Wheels and other home delivered meal programs. We have community cafes for social dining gatherings, and we also do a restaurant dine-in program called As You Like It. We have an adult day center in Biddeford, Maine, as a place for folks with memory issues to go and have socialization and engagement and provide some respite for caregivers. We are very engaged with volunteers. If you're looking for volunteer opportunities, either with our programs or other places in the community, it's a great place to check out. And we also offer just a lot of assistance around benefits available to older adults. We offer Medicare counseling and group education for people new to Medicare, and we're headed into the very busy open enrollment Medicare season right now, where folks can review and change their Medicare coverage options for the coming year. But we help people with application assistance for things like housing, heating assistance, and so many other things. So if you have questions about aging resources, please get in touch with us. And some of the other programs I haven't mentioned yet have to do with wellness and physical activity and falls prevention. At SMA, we call those the Age Well programs. And a couple of workshops that you might have heard of are Matter of Balance and Tai Chi for Health and Balance. And these two programs are really wonderful ways to get involved in your community, but also tools to teach you more about being physically active and what behaviors and strategies you can maybe modify in your own life around risk factors you might have for falls. If you've noticed a change in your balance or you've had a fall recently, both of those are great reasons to check these types of programs out. Matter of Balance is a little bit more of a classroom style program. We learn a lot about the different risk factors for falls, and then the kinds of things that we can do in our own lives to make a difference in that. And that could be anything from home safety to being more physically active. The program does include an exercise routine that we practice together. And it also talks about how we can speak up for ourselves with our healthcare providers and with our family members, and let them know what our needs are, where we need help, maybe where we don't necessarily need help. So Matter of Balance is a really great program. It's very social, very conversation based. And Tai Chi for Health and Balance is an introduction to Tai Chi. It's a very gentle program. Over a 10-week program, you learn a whole series of movements that are really wonderful for practicing and improving balance and increasing strength and flexibility through the whole body. And that also is a nice social engagement. That's one of the things that comes out of the feedback we hear about our classes is we know that they have certain outcomes about making us physically stronger, but people make friends and build new connections with folks in the class that are really valuable as well. So both of these programs are offered both virtually and in person. Given the times, we're doing the best we can with in-person programming. We have limited options right now. but we are making things available in the convenience of your own home, if that's something that's a good fit for you. And we have an upcoming Matter of Balance program in collaboration with the South Portland Library that will be starting October 12th and running through mid-November. It meets twice a week. And if you're interested in that program or any other programs that we offer, either around falls prevention or anything else, you can contact the Southern Maine Agency on Aging by calling 396-6500 or visiting our website, www.smaaa.org. All our events are always listed on our website, as well as additional resources and information about all the programs and services that we offer. And we'd love to hear from you and see you in a program soon.
Thank you for watching Age Friendly South Portland's Healthy Aging Virtual Vendor Fair on developing strength and balance to overcome everyday challenges. We hope you learned a bit about best practices, lessons learned, and available resources in our community on how to gain strength, balance, and activeness as a way of overcoming the risk of falling as we age. For questions or comments about Age Friendly South Portland, please contact us via email at agefriendly@southportland.org, as well as through Facebook at www.facebook.com/agefriendlysp.